Hello, it's Dr. Rhonda Johnson. Today is Monday, August 17th, 2020. And today I'm going to be talking about an update on a recent study released by the CDC about the impact on mental health from this pandemic, and also answering the question, trying to answer the question, can someone be reinfected with COVID-19? I'm going to take the second part first because it's a little easier for me. So the question is, can someone be reinfected with COVID-19 who has recovered? Well, like everything else with this pandemic, it's not a clear yes or no. No one really knows the answer. Because the CDC says you can recover from COVID-19 and you may have low levels of the virus in your body for up to 3 months after diagnosis. And your COVID virus test, the PCR diagnostic test, can be persistently positive also. So here's the catch. You can be shedding low levels of the virus during your recovery, but it doesn't mean that you're contagious for 3 months while you're shedding the virus. So the CDC says that recovered persons can continue to shed detectable SARS-CoV-2 RNA in upper respiratory specimens for up to 3 months after illness onset. That's the official version from the CDC website. So then you may be wondering, well, when are people contagious with this virus? According to the Centers for Disease Control, again, you are most contagious early in this infection before you have symptoms, which, again, it highlights how contagious this pandemic is. You are least contagious 10 days after symptom onset. Now, what do they mean by symptom onset, you may ask? Well, it's defined as the date on which symptoms first begin, including non-respiratory symptoms. That means you don't have to have fever or cough. You can have headache or diarrhea or vomiting, or you can have a loss of taste or loss of smell. So whenever you feel your first symptoms coming on, that's your symptom onset. And you want to start counting on that day as day one. So I'll go back, and for those of you who have recovered from COVID-19, most people say it probably was the worst experience they've had in their lives. I've heard that over and over again from people that I know who have recovered. So can you be reinfected? Well, here's the thing. If you're around somebody who has COVID-19, you may need to have an evaluation for reinfection if you are showing symptoms of the disease. And you need to isolate and contact a healthcare provider to be evaluated for other causes of your symptoms. Because, the flu season's coming up. And in early COVID, it can look just like the flu, with a cold or cough or sore throat, mild fever, muscle aches, pain, headache, vomiting, diarrhea. It's hard to distinguish that from the flu until the symptoms start getting more severe. Okay, so how long do you need to be in isolation if you get COVID-19? Well, the short answer is 10 days for most people. 10 days after symptom onset and resolution of fever for at least 24 hours without the use of taking medications for fever, and with improvement of your symptoms. So if you've got COVID, if you're going through this now, you want to know when you could come out of isolation, well, see how your symptoms go. Start keeping a calendar. Log your symptoms so you know how you're feeling. And 10 days after your symptom onset and resolution of your fever for 24 hours. That means you must have a temperature that's below 100.2. And to be sure, I'd say below 100. Now, those folks who are severely immunocompromised or have other conditions that affect their immune system, they may shed virus for 20 days and they may need to quarantine longer. That's why it's so important to have a doctor overseeing your care when you have COVID-19. Okay, I want to shift gears and talk about something that I think is just horrible news. The CDC did a study and they published it in the Morbidity and Mortality Weekly report last week. And it says that nearly 11% of American adults seriously considered suicide in June of this year. They surveyed 5,470 people in the last week of June, and 31% reported symptoms of anxiety or depression. 25.3% reported traumatic stress-related disorder, and 13% said they were using substances to cope during this pandemic. And another 11% reported that they seriously considered suicide in the prior month. So that's pretty serious. I think it's pretty gloomy. And so I bring that up to share. And also the report said that Black and Hispanic respondents had higher rates of suicide ideation and higher rates of anxiety and higher rates of depression. And the response was greatest, the risk of suicide was greatest in young people between the ages of 18 and 25. So this has got to be seen as a call for help, in my opinion. And so, I'm not a mental health therapist, I'm not a psychiatrist, but I do want to share that there is a national suicide prevention Lifeline. It's a hotline where they have trained people that if someone out there is having thoughts of suicide, please call this number. It's available in English and Spanish, 24 hours a day, 7 days a week, 1-800-273-8255. And I'm going to include this number in my post. And I also want to say that last Friday, August 15th, on my Facebook page, I talked about a self-help tool called Face COVID, F-A-C-E, COVID. Please check that out and feel free to share the information with anyone you know that may be struggling during this pandemic. Sometimes all it takes is to know that someone cares. And if you're experiencing this high degree of stress, anxiety, depression, please seek help. Reach out. This pandemic is hard for most people, but our young adults may be especially vulnerable, according to this data found by the CDC. So this is Dr. Rhonda Johnson. My views are my own. Stay safe, folks. Stay alive. Stay well. And I'm going to add one more phrase. Stay connected. We're going to be dealing with this pandemic for, I don't know how long, but for a while. And it's going to be important for all of us to stay connected to one another. And we'll get through this one day at a time. This is Dr. Rhonda Johnson again. My views are my own. Have a blessed day.